Hi, everyone. My name is Molly Baker, and I currently work at the Clinton Health Access Initiative as an Associate Director for various operations and analytics projects. I am so grateful to be here today to share with you my journey, the challenges I've faced, and the growth I've experienced alongside other women over the past year as a part of the WomenLift Health community. When I initially submitted my application to be a part of this group, I couldn't have predicted how it would intersect with significant changes in my professional life. At the time, I applied to this program because at that point, I had recently moved into a new role and found myself with more responsibility, yearning for mentorship and guidance, particularly from other women. As I took on this responsibility, I was struggling with the confidence necessary for decision making, and I felt I needed tools and skills to navigate these challenges. My hope was that through this experience, I could learn from others and refine my own leadership skills. What I didn't realize at the time was that this year would bring more transformation than I had expected. Shortly after starting this journey, I transitioned out of that role and into a whole new role with a new set of responsibilities and new explorations, giving me the opportunity to experiment and work with new teams. I've been able to dig into the data in fresh ways and approach problems with a new lens, one that pushes me far outside of my comfort zone. Along the way, the guidance from the WomenLift Health team and my peers in this group have been invaluable, helping me to navigate this period of professional growth and change. Today, I'll talk to you a little bit about how I use some of the tools and reflections that I gained during this journey and applied those to my leadership projects. This project on our organizational climate accountability and gender stems from my work to understand our organizational carbon footprint over the last few years. For those unfamiliar with the term carbon footprints, it is the amount of greenhouse gases or pollution that we emit into the atmosphere through our daily operations. These emissions are the causes of climate change. Like many organizations working in global health, business travel is the largest contributor of our greenhouse gas emissions. This poses a difficult problem. All of our work, including our travel, is important to achieving our mission to save lives. However, it has the indirect consequence of contributing to climate change, which we know will disproportionately impact the same populations that we intend to serve. So how do we reduce our carbon footprint without compromising the quality of our work? In this question, I also saw an opportunity to explore further, particularly by applying a gendered lens, and question whether inequities in access to travel might impact a woman's opportunities for advancement within our organization. The goal of my project is to use the data that we have available due to our footprint calculations to better understand whether women or different groups of people have equal access to travel, and if inequities in the access might contribute to disparities in leadership opportunities and promotions. Depending on the outcomes of this research, my goal is to be able to explore ways of reducing our organizational footprint in ways that will improve equity and access to job opportunities. Over the last year, I've been able to use self-reflections facilitated by WomenLift Health to better understand my communication style and ability to influence within the organization. With this understanding, I've crafted messages for leadership to gain buy-in for this project. In completing a stakeholder analysis, I also identified our DEI officer as a key partner in this work and have begun discussions with her. Finally, I began working with our HR team to map travel data to demographic data. Data availability has been a little bit of a challenge, and the analysis is ongoing. Our sample size is also small since many of our staff don't travel, but my hope is that the data combined with stories about how travel has impacted people's career trajectories will provide a powerful message. Looking ahead, I'm excited about the possibilities for the project. I plan to fully dive into the information that I've gathered so far and bring together the insights around gender equity and advancement opportunities. I will continue to work with our DEI officer and gender team to refine our approach and look for ways to leverage existing data on travel and gender to promote greater equity across the organization. This project holds personal and professional significance for me. It's the first major initiative I've undertaken outside my comfort zone within finance, and it offers a unique opportunity to combine my skills with a topic that is challenging but rewarding. The lessons I've learned from WomenLift Health and the ability to discuss and receive encouragement from my peers on this journey have been instrumental in shaping my approach to communication, strategy, and stakeholder engagements. By looking at our carbon footprint through the lens of gender equity, I believe we can drive both environmental sustainability and greater inclusivity within our organization. In closing, I want to express my gratitude to Women Lift Health for equipping me with tools and support needed to tackle such an important and complex issue, as well as my colleagues at CHI who have worked on this project along the way. The project is the continuation of a larger conversation, and I look forward to keeping on with this work, using it as a platform to drive both professional growth and positive change within my organization. Thank you.